how many times do we keep taking vaccines? I'm sure you must have seen, and our viewers must have seen all those WhatsApp forwards where you have like 10 booster doses, right? All on your arm, 2020, 21, 22, and then you keep taking it. And we're all, I'm sure, sick of vaccines now. How many times can you keep taking? So I cannot say for sure, but my guess is we probably won't keep needing vaccines forever. Definitely not. I don't think it would become like an influenza. I don't think so. And influenza also, actually, there is a change every year. That is why we are taking a vaccine, influenza vaccine, every year, because the strains of influenza change every single year. So I take an influenza vaccine every single year because there is a new strain. What immunity I had last year, it has changed to something else this year. So I have to take a new one. So if the strains, the circulating strains of COVID, and I think that is what it will evolve into. The WHO usually monitors the influenza strains in different countries, northern hemisphere and southern hemisphere, because the cold and weather patterns influence the influenza. In the same way, there will be a monitoring setup that already exists, and it will be probably more streamlined to pick up which variants are coming in which countries, in which seasons. Based on that, they would probably recommend vaccination if the number of infections is significant. Okay. If the number of infections is not significant, like you see avian influenza, okay, those pandemics are small cases are coming, not a pandemic, sorry. But we don't recommend any vaccine for that, right? Even the influenza vaccine, we don't necessarily recommend for the whole population. We only recommend it in the high risk groups. So we might recommend a booster dosages for certain high risk populations or high risk individuals, like doctors who are more in contact with patients who might have infection. Those might be required to take a vaccine in the future. And that also might evolve. And if the COVID cases truly go down, which seems to be the cases right now, the trend, and at that point, we probably will not keep taking vaccines anymore.